This is a model of the human heart. You can start with the external anatomy, the two auricles, the right auricle and then the left auricle. Inside of there you'll have the left atrium and the right atrium. Then you can see the right ventricle underneath here, the left ventricle underneath here. This sulcus, interventricular sulcus, is an important landmark because it separates the left from right side. The great vessels, superior vena cava up top. The inferior vena cava can be seen if you lift this model up over here. Pulmonary trunk then leads to the left and right pulmonary arteries, where it goes to the lungs to become oxygenated. It then returns back to the heart via the pulmonary veins right here. And over on this side you can see the right pulmonary veins. The aorta is a very obvious large artery that comes out, and it has the brachiocephalic artery or brachiocephalic trunk, left common carotid artery, and then left subclavian. This then leads down as a descending aorta, thoracic, and then ultimately the abdominal aorta. Coming off the aorta, you get the left coronary artery and then the right coronary artery, which passes underneath this auricle. From the left coronary artery you lead to the anterior interventricular artery right here. Going underneath the left auricle is a circumflex artery. The right coronary artery comes over here and then leads to the marginal artery. It continues around the backside leading to the posterior interventricular artery. The veins on the front, coronary veins, you can see the great cardiac vein right here, small cardiac vein right here. When you look at the backside you'll be able to see the coronary sinus, and in the middle cardiac vein. Now that this model's open, you can see the internal chambers, the of course left and right atrium, the pectinate muscles, the bridges that you can see inside the atrium. You can see the opening in the atrium that allowed blood to flow as a fetus. It's now closed. This is called the fossa ovalis. It used to be the foramen ovale. It's closed now. The atria lead to the ventricles, and connecting the two, or I should say regulating the blood flow, are these AV valves. This is the tricuspid valve with the chordae tendineae attached to the papillary muscles, and this is the bicuspid valve, also known as the mitral valve. These are the chordae tendineae and papillary muscles for that side. These muscles, these struts of muscle inside here, these are called trabecula carneae, giving extra surface area and contractility. You can see the interventricular septum shown between the two. Right. Additional valves that you'll be learning about: the semilunar valves. This is the aortic semilunar that opens up to allow blood flow to leave the heart. And then the pulmonary semilunar, which is actually on this half of the model over here, because when you put this back on top, the pulmonary trunk, this is the valve. So when you put this model back together, then